Key problem is the length of stay. So traditionally patients would stay, 5 days, but that was because they didn't have the education, the information at their fingertips. By bringing in the MAJR Accelerated Joint Replacement Program, patients are able to get real information, real education, and it just goes to show that that education has reduced their length of stay.
Across the last 18 months, throughout the pilot, we've had about 180 patients go through the MAJR program. Our length of stay goal was less than 2 days, and it currently sits at 1.63 days, which is pretty significant in terms of us achieving a shorter length of stay. And our net promoter score, so how happy patients are with the program, is 94%, which is in the excellent category, which is great. And I think a really good reflection of how they value the input they receive from the MAJR program.
I guess the biggest thing is patients who aren't on the pathway don't get the information to the exercises, what to expect after surgery, and access to health professionals, nurse and physio throughout the whole process. So often when people discharge home, they think they're on their own. With the MAJR program, there's a chat function, so any issues with pain, swelling, concerns about the wound, they're able to message us through the app. There's also a series of questionnaires that get distributed on certain days post-operatively, and anything is flagged, so any answers that are out of the ordinary will flag us to actually call the patients. So I guess it's really good communication throughout. They don't feel like they're on their own, and that's the biggest piece of feedback we get, is they felt so well supported throughout the program.
Traditional hip and knee stays, so we've run some data for surgeons who are currently admitting patients and surgeons who are admitting patients on the MAJR program, so same time of year, same surgeon, same hospital, and it's about 1.5 days less when they're running through the MAJR program versus their traditional patients. So that's pretty significant, and I think statistically shows that it's a very successful program.